good morning.
Hello, good morning.
How are you?
I'm good. How are you?
Yeah, I'm also good. Thank you so much for attending this interview today with us. So, we are all here to know about your experience at your workplace. So, feel free to share your thoughts with us. My name is Kamalpreet Kaur. Before starting this interview, I would like to introduce my team members who are also participating for your interviews.
Hello,
Hi.
my name is Manpreet Kaur
Nice to meet you.
and my name is Jasmine Kaur.
Nice to meet you as well.
Can you please start by introducing yourself?
Yes, of course. So my name is Harpreet Kaur and I'm working as an enrolled nurse in a residential care at the moment.
Oh, that's nice. So, how long have you been working at your workplace?
It's been 3 years now.
Oh,
Okay.
that's great.
Yes.
So, could you please let me know about your workplace and how's your experience over there?
Yes, of course. As its name indicated, it's a residential care. So we provide care to the residents on their needs of care and on their requirements as well. And it's there are the different roles and responsibility that as a nurse we have to do. We have to take care of the residents, administering medication. We have to do the different assessments just to create their care plan, and also we have to coordinate with the different health professionals just to create their care plan so that we can assess their mobility and medication and their diagnosis and up to date the charts according to them.
Nice. That's nice. So it seems you are enjoying different kind of experiences over there.
Yes.
But have you ever faced any challenges while performing your task in your organization?
Yes, of course, because every field has a different kind of challenges. So nursing field also have some kind of challenges. So general challenges that we always face in the different places. First of all, is a communication gap. Sometimes
Okay.
there is a communication gap between the different team members because as I told you that we have to coordinate with the different health professionals. But if there is no proper communication between the different health professionals, then it definitely impact the quality of care of the residents as well. Another thing I can say, there is a language barrier because as we know this is Australia and people comes from different
definitely.
culture and we have to deal with those people as well who doesn't speak English.
Yes.
So yeah, that's the major barrier as well in the healthcare sector as well. So there, apart from this, there are some IT challenges as well.
Yes.
Because we have to deal with the IT system to do most of the tasks. So first of them is the double order. Sometimes there is a double order of the same medication, and sometimes there are the different outages experience as well. When they have to do the maintenance of the IT system, there is outages. And another thing I can say that there is a renewal of medication. Sometimes there is a renewal of medication, double placing at the medication chart, and when we have to administer that medication, it pop up as a the previous medications on the chart as well. Yes, so there is a another challenge that the people face in the healthcare sector is a user friendly.
Yep.
Because most of the aged care have the different kind of systems, but
Okay.
some of them have the common system that we are not using. So whenever doctor comes, they are addicted to that particular system, so they have to deal different problems, facing the different problem while charting the medication or while updating any information on the medication chart. They have to face the different problem. So I can say that it's not user friendly, like it's not like common everywhere. So yeah, that these are the kind of problem that we have to face.
Sounds challenging, but can you please clarify about the double order medication?
Yes.
Yeah.
Yes, of course I can. Actually, double order is like, as the name indicated, it's the double time of the same medication.
Yes.
So sometimes doctor just want to chart one medication, but there is a technical glitch and it shows twice on the system. So for example, if there is a paracetamol and paracetamol, there is a one order, but it comes as a two order on the same time. So it's like for non-regular staff and for the person who is not familiar to that system or familiar to the facility or resident as well, then there are the chances to got confusion, and that confusion can create a chaos, and we have to follow up for that one so that doctor can amend that medication or amend that problem. So we have to wait for a long period of time. Sometimes it's a one day or sometimes doctor is not
Okay.
available. So yeah, that's the double order problem.
Okay. So You explained about the renewing medication in your
Yeah.
problems as well.
Yes.
Can you please little bit more?
Yeah,
Yeah.
renewed
Yes.
medications, yes.
Yeah, of course. Renew medication, it means like whenever there is some regular medication on a person's medication chart,
Okay.
then they are for specific period of time. For
Yeah.
example, if there is some medication that's starting today, it's going to expire after 1 week. So
Yeah.
it's the specific period of time.
Mm.
So after that 1 week, doctor has to renew the medication.
Okay.
So that's the renewing the medication. But that problem we have to face sometime when doctor charted renewing the medication,
Mm-hmm.
they just renew the previous medication as well. Like for
Oh.
example, short-term medication.
Okay.
Mhm.
Yeah.
I can explain a bit more just to make you understand.
Yes,
Like
yes,
for
yeah.
example, some person have infection. That
Okay.
infection will not last long. So it's for 1 week they charted one kind of antibiotic. So it's only for short period of time, and
Okay.
it will expire after 1 week.
Of
So it will
course.
disappear from the chart because
Mhm.
it's going to expire.
Mhm.
But when the next time doctor will come to renew the regular medications,
Mhm.
when he started just to renew all the medication, it comes like pop up again that short-term medication as well.
Okay.
That doesn't require at that time because
Mhm.
person doesn't have infection,
Yeah.
because it was the
Yes.
previous whenever the time when that person had infection and whenever the time that person was having that antibiotic that doesn't need today. But it's a technical glitch,
Yeah.
specifically that comes. So it can create confusion because if you are non-regular in the healthcare sector and if you are not like regular staff in the particular facility, then you definitely search for that particular medication where it is and you will ask the staff. So
Yes,
that
definitely.
you have to follow up again,
Yeah.
and it can make like your work more hard.
Yeah, of
Yeah.
course.
Yeah.
That's very hard. You are facing these problems.
Yes.
So, with these problems, do you think that these problems also impact on the residents' care?
Of course, definitely, because all the system is related to the particular residence, and every medication chart is a different for a particular resident. So yeah, of course, the quality of care also affected because we have to withhold that particular medication until doctor doesn't give us proper clarification.
Mhm.
So we have to withhold. If for example, if person have infection and he immediately need that antibiotic, we can't give until doctor will not clarify the order.
Oh my
So
god.
yeah, definitely, yeah.
Yeah.
Okay. So how do you manage all these problems on the spot?
Actually, on the spot, I can say that sometimes there are not specific, solutions
Yes.
because it's related to IT. But what we can do, we can, give feedback to the management, and we can directly contact with the doctor, because if I'm a regular staff, I know that this medication doesn't require or this medication is required. I know that. But yeah, then we can follow up with the doctor. We fax to the GP so that he can remotely amend it, the order, whatever the order is wrong. So
Okay.
he can amend that order as well. So on the spot, these kind of little solution that we have to find out at that time.
Okay.
Okay, that's great.
That's nice.
So with these problems, do you think there is any need of improvement in your software?
Yeah.
Yes, definitely, because there are challenges, so we need improvement as well. So I think if there is some kind of different improvements to remove these glitches, to make just work more effective and efficient, then definitely
Yeah.
there must be some improvement.
Yeah.
So that the regular or non-regular staff doesn't have to perform face these kind of challenges or problem, and it will not directly impact to the quality of care of the residents as well.
Okay. So according to your opinion, how could you improve the better sport at your work?
I think if there will be no glitches, then the system could be improved by making some changes. For example, if there will be no double order, then it will automatically improve the system as well. So we don't have to go within the long process or follow up and everything. Another thing, I think there is it's the maintenance time that can be changed. So, I know it's the care 24/7 and we need the system 24/7. But if they have some additional backup, like a small system that can be used for a short period of time, so that they can take the maintenance at other level, that would be also great help and improvement as well. Another thing I can say that if there will be more user-friendly interface that can be used by the non-regular staff or non-regular GP or non-regular health professional, then it will be also improvement that can be help more effectively and efficiently
Yes,
to
ma'am.
provide the
Yeah.
accurate care.
Yeah.
Yeah.
Okay, that's great to hear. So, are there any new feature you would believe to enhance the software usability?
Yes, of course. If there will be new features that can make more reliability and give more accuracy to the work, then there is no harm to add more feature. For example, if there is a more user-friendly interface, that development can help to the non-regular staff and non-regular health professional to give more accurate data and more accurate quality of care as well. Another thing I can say that if there is a tutorial or training that can be done by the IT
Yes.
department, it
Yes,
will also
yeah.
help the IT professional that can give the confidence to the non-regular staff and non-agency staff as well.
Yeah.
You just to that improvements also on new features can also enhance the quality of care as well, so that the regular staff doesn't have to follow up the non-regular staff or GP, just to they can focus on their own work, so that own work that can be make impact on quality of care as well, because they don't have to be go with everyone and they will not have any burden. So yeah, I think that new features that involve in the care of the residents and completing the different tasks on time and focus on the particular things, then there is really need of the new features.
Okay, that's interesting.
Yeah.
Do you have anything else to share with us?
I think I have shared all the things at the moment. So yeah, that's good at the moment. Yeah.
Okay.
Okay,
So,
thank you for your time and the
Yeah.
information you provided is very insightful.
It's alright.
Thank you.
Thank you so much.
Thank you.
Thank you so
Nice
much.
to meet
So
you
thank
guys.
Yeah, same to
Yeah.